So that is definitely one of the unmet need that exists in the field. Because despite the recent advances in AML in total, with the invention of BCL2 inhibitor venetoclax, a couple other agents, there has not been anything translated into post-MPN AML, as we call the blastic phase. We actually haven't had any super improved survivals in those patients, which is very dismal. It's about 6 months. Even in our largest series, we have not had patients that would survive longer if they have not had allogeneic stem cell transplantations, which is the only curable approach. So there are some movements in the field as well. There were some preliminary and preclinical data mostly that might lead in the practice about a couple agents. They are shown even from our own group. Definitely the bromo domains are kind of like looking there as well. We have the investigation initiated. Maybe the BCL-XL as a novel will move into the kind of like topic. The PROTACs or the degraders would be interesting in that point. However, we have not really seen anything that would give us such a breakthrough kind of like look like, hey, what about this one? So yeah, field moving, definitely it's gonna represent the most unmet need, where I think a lot of the research is gonna focus and the field is gonna move on, because right now we will have a lot of options for chronic phase myelofibrosis. We will pretty much have none options for the blastic phase of myelofibrosis, which is defined as a typical AML with 20% blasts or more. As well, we will not have anything for the accelerated phase, which is the blast 10% or more, 10 to 20%. Well, we have published from our own series that even 5% are actually behaving very badly and looking like 10%, which does make sense even from the MDS. If we take correlative from MDS patients, 5% is already bad. So we need to design better clinical trials to address in this gap, and basically focus on patients that what we call are blasting through it. So they are about to transform to blastic phase, where we haven't been able to define agent that is gonna really revert or improve, because at that point the disease is just very aggressive, but rather doing earlier intervention at the time the disease is about to progress or has an increased blast. So I think that is really gonna be the topic of this decade.